you keep playing to where the puck was and not to where the puck's going. Where the puck's going here, it's probably already there, but we are still focused in a older way of dealing with this type of misinformation. So the issues that you discussed, I think, are so important. Jordan, you mentioned the Surgeon General. He issued, as you said accurately, he issued a Surgeon General's warning about misinformation. That's the highest level that a Surgeon General can do. It's what the Surgeon General did years ago with tobacco and cigarettes. It's what the same Surgeon General, Vivek Murthy, did a few years ago with opioids. That's as loud as he can ring the bell. And when he said that misinformation is costing lives, I don't think he was exaggerating at all. So we have to find better ways to comprehend it, to communicate it, and certainly to cover it as journalists. So thank you for all of that. I knew at the time that things were going to escalate quickly. I underestimated how drastically they would escalate, and certainly the duration of disruption that it had in store for us. I also underestimated how fierce this information sphere would be, and the resistance that we have encountered when trying to communicate public health facts, to be frank, caught us all off guard. It caught me off guard, caught me on my heels. And I'm still reflecting on the missteps that we had in the public health community, and what we could have done better earlier on to set the record straight, and what we need to do going forward. And I wanted to talk a little bit more about that. Not all untruths about public health or COVID or the vaccine are the same. And we'll probably get into this more, but it's helpful to me to characterize them as misinformation and disinformation. And by misinformation, I mean well-intentioned untruths, myths that people spread inadvertently that aren't true, but are not spread by malice. And I think a lot of the social media that you kind of mentioned a minute ago likely gets spread in that fashion. Someone's relative reading something and sharing it or posting it, not understanding where it's coming from, not knowing that it's false, but certainly not as a deliberate attempt to misinform someone, just myths that unfortunately get propagated. We had stark racial disparities in Louisiana early on in the vaccine campaign, in part with the same access to care issues that we deal with every day, but also in part to a lot of myths. And particularly the myth about fertility was very prevalent in a number of underserved communities across Louisiana. We identified that through the partnerships that we have, through the work of Ali Neal, our comms director, through the Bring Back Louisiana campaign, through media partners. We were able to really target that myth and empower local stakeholders and debunk it and pre-bunk it when we knew we were going into a setting, and all the things that we know are effective. And we were able to make progress. And now Louisiana is one of the small handful of states where the rate of vaccination amongst African Americans exceeds that of whites in Louisiana. Point being, for misinformation that gets spread unintentionally, I think once we're able to identify it, we can work towards combating it and show results. I've been less bullish on our ability to combat the more deliberate sources of disinformation. And this, I think, has caught the public health community off guard. The anti-vax, anti-science movement is stronger than it was 5 or 10 years ago. It's better funded, it's better organized. And I don't think we have found a great way to combat it. There are groups that have an agenda, that are deliberately exploiting people's fears and uncertainties about this pandemic, and there are many. And are doing that at great harm to families and communities who get caught up in that. That's what I think we need to be focusing on, is how do we combat that in this new sphere? And journalists and people that write about this and communicate this have a very, very large role to play. It's not easy. It's really not easy. Do you cover both sides? How do you cover both sides? Do you ignore the deliberate disinformation? Do you call it out for what it is at the risk of giving it more prominence than it deserves? All of these are tough questions. There's no one right answer. I do want to recognize Blake. I think Blake does a tremendous job at the advocate of doing that, and it's really, really hard to do. But those are the type of questions we really have to be getting into. This disinformation campaign, number one, has cost lives. Absolutely no doubt about that. Hard to quantify how many, but I can tell you specifically from working in the ER clinically that I have treated families, patients who have fallen victim to these disinformation campaigns and suffered harm because of it.
We're not trained to communicate about science for the most part. We're trained to do the science. We're trained to give the evidence of what we need to be doing and inform public health recommendations. But in general, we are not equipped to work with the public with regards to communication. So over the last 2.5 years, I have essentially spoken with one-on-one more than 3,000 vaccine hesitant people across the United States. This is work that is not the easiest work, as you can imagine. People get in your face, people want to yell at you, people want to say that it's a hoax, it's a conspiracy. And one of the things that I've really learned through all of this is really a sense of humility. It's thinking about how do we meet people where they are. Every single person that's going through this vaccine decision-making process is going through a rational process. The number one myth that I get when I speak to people is, I am convinced there is a microchip in the vaccine. The second key issue that we found related to COVID was this issue of historical trauma, racism, and discrimination. So these are structural factors. We teach structural racism at the School of Public Health. We believe it is a real thing. And we know that the way that individuals engage with the healthcare community really affects whether or not they actually agree to engage in the recommended behavior. So we know that's a key issue as to why we're seeing disparities as well. The third, I would say, is really misinformation that's been fueled by social media, and that has been a huge, huge challenge. So some of the things that we have been working on, so again, I sit at this weird intersection. I'm probably the only faculty at the School of Public Health or the School of Medicine that has a background in journalism, but we've been working really hard to figure out ways in which we can reduce vaccine hesitancy. What's the interesting piece about all of this is that communication underlies all of this, whether that's communication with your doctor, whether that's communication with your friends on social media, or whether that's communication with the media and journalists in general. And so what we have tried to do is spend a lot of time, and we kind of focused on a couple of different games related to misinformation. So one is called goviral.com, the other one is called getbadnews.com. If you have not seen these games, essentially what they do is they teach you how individuals that spread misinformation, what are the techniques that they use. And then they use something called pre-bunking and inoculation and debunking as well. How do we leverage peer conversations, right? If there is a decline in trust in government institutions, people are less trustful of going to their doctor. We know a lot of young people don't even have a primary care physician. How do we equip parents to have these conversations? So essentially, we took concepts from these different games and we developed it into this free Coursera course that's called Peer Ambassador. And I will say, with regards to key strategies that we can use for communication. So if you're having a conversation with someone that you might not see eye to eye with, right? These are challenging conversations. They don't have to be health related. They could be politically related. There's a couple of techniques that we can use. I would argue that all of this has to be grounded in empathy. We've done a lot of studies that have looked at this and have really focused on if someone comes to you and says, hey, Rupali, I know there's a microchip in the vaccine. It's very easy for me to dismiss that concern. That is literally the wrong thing to do, right? It's how do we engage with the person? How do we talk to them in an empathetic way and in a compassionate way so that we understand and they understand that not only do we hear them, but we're acknowledging them and we're trying to think of ways to problem solve together. The other issue that I will say that I think is really key here in terms of solutions is working with social media platforms. And we've done quite a bit of this over the last 2 years. So several of us sit on the Facebook Health Advisory Board, where essentially they are the folks that work on the algorithm that flags misinformation and disinformation. And now they're currently working on how to downgrade specific types of information that might be not true. It's really important for us to engage with social media platforms, even if we don't want to, and it's a big sort of mess. We've been spending time really thinking about, they need to really be a partner for us that work in public health and not an adversary, which is what I think sometimes a lot of people perceive that relationship. My students have been teaching me a lot about how do we leverage different platforms for younger people, like TikTok, for example, which I know very little about, as well as Instagram, for example, where more young people are sort of moving to. I think the message stays the same. I think what ends up happening is how do we deliver that message and what's the messenger is what we need to think about in terms of changing, because young people are still lagging behind. Obviously the 5 to 12s were lagging way behind. fingers crossed we'll have an EUA for under fives coming soon, but we're gonna run into the same types of problems, I think, with younger populations.